Shock is a clinical syndrome that results from inadequate tissue perfusion, or shock is the most common of death among the surgical patient. Most common type of shock is the hypovolemic, followed by traumatic, cardiogenic, septic, neurogenic and hypoadrenal. मॉनिटरिंग इन शॉक सबसे ज़्यादा क्या इंपॉर्टेंट है, पल्मोनरी वेज प्रेशर जो है वो ज़्यादा इंपॉर्टेंट होता है देखने के लिए. देन इन्वेसिव आर्टेरियल प्रेशर इज मैंडेटरी. ब्लड प्रेशर एनालिसिस स्पेशली इन केस ऑफ मेटाबॉलिक एसिडोसिस. मिक्स्ड venous oxygen saturation and urine output is the most clinical guide to tissue perfusion. That is important. Then hypovolemic shock. This is the most common of shock. It is occurring due to blood loss like trauma, bleeding. If there is a loss of plasma due to extravascular fluid sequestration, especially seen in the burn, loss of body sodium and water in case of the diarrhea and vomiting. What is the pathophysiology? Decrease intravascular volume, so venous return will be less. So venous filling will be less. So stroke volume will be less. If stroke volume is less, the blood that is circulating in the body, that is cardiac output, will be less. So inadequate tissue perfusion and compensatory mechanism activation will be start. Inadequate tissue perfusion lead to the cold clammy skin, oliguria, lead to anuria, drowsiness and confusion will be present. Inadequate tissue perfusion lead to the lactic acidosis, metabolic acidosis and trachypnea, means depth of respiration will be more. Compensatory mechanism activation, there will be sympathetic stimulation, increased adrenaline and noradrenaline. What is the sympathetic stimulation symptom will be, we'll see, the pulse will be more. Always remember, in hypovolemic shock the pulse will be more, not less. Tachycardia will be present. How the character? Quick or 3D pulse, because the peripheral resistance is more. Followed by sweating. Initially maintain the BP, followed by there will be hypotension. There is a classification is there, 1, 2, 3, 4. In 1, blood loss is 0 to 15. Slightly patient is anxious will be there. Pulse will be less than 100. Blood pressure normal, pulse pressure normal, respiratory rate 14 to 20, and a urine output more than 30. So next is 15 to 30. Mildly patient will be anxious, pulse pressure will be decreased. There is no such changes. In 3, patient will be anxious or confused, blood pressure is started decreasing and pulse pressure also decreased. In the 4th, patient will be confused or lethargic, both the blood pressure and the pulse pressure will be decreased. So if there is any trauma or history of bleeding, the clinical feature in 1, compensatory mechanism maintains the cardiac output, compensated hypovolemic shock. In class 2, hypoxia, hypotension, generalized vasoconstriction will be seen, and the urine output 20 to 30 ml per hour. In 3, decompensated shock will be there, decreased CO means cardiac output and decreased systolic blood pressure. Hypotension, tachycardia more than 120 per minute, trachypnea will be present, and the urine output 5 to 15 ml per hour. Patient is very confused. And the 4th stage, refractory stage, where the marked hypotension will be present, tachycardia and trachypnea will be present, no urine output, patient is comatose position. The next one is the cardiac shock. The cause is myocardial infarction, myocardial in depression like beta blocker, calcium channel blocker, antiarrhythmic drugs. Diastolic dysfunction if they are present, ventricular hypertrophy, restrictive cardiomyopathy, cardiac tamponade. And if there is a low risk mode like aortic stenosis, malignant hypertension, and some valvular abnormalities like papillary muscle rupture, aortic mitral regurgitation. Some arrhythmia also if present, they will be present. To impair pumping capability, so stroke volume will be decreased. Inadequate systolic emptying, stroke volume decrease, so cardiac output will be less, BP will be low, and less tissue perfusion. As the blood is not going, so emptying will be inadequate, so increased pressure in the left ventricle, preload will more. Then increased left atrial pressure, increased capillary pressure will be in the pulmonary artery, lead to the pulmonary edema. The symptom will be present like myocardial failure, increased JBP, reduced pulse volume, hypotension, tachycardia, and the crackle sound will be present in the base of the lungs. Obstruction symptoms like muffled heart sound, pulsus paradoxus will be present. Pulmonary embolism symptoms like sinus or dyspnea, tachycardia, tachypnea, hypotension, localized pleural wrap will be present, and the severe chest pain in the massive emboli will be present. Other than this, cold clammy peripheries like pallor, peripheral and central cyanosis will be present. Next comes the septic shock. Septic shock refers to sepsis accompanied by hypotension that cannot be corrected by infusion of the fluid. So in the pathology will be like this: gram positive, gram negative, or any virus or any fungi. Chest wall is endotoxin or exotoxin. What is causing exotoxin? Exotoxin are telling that they are doing the vasodilatation, capillary permeability will more. So there will be dilatation will be lower in the peripheral circulation and shock will happen. In infection, local inflammatory reaction are coming, systemic inflammatory response, Diffuse endothelial injury will be there. There will be vasodilatation, progressive vasodilatation, and there will be maldistribution of the blood flow. Equally, blood will not distribute it. So organ hypoperfusion and multi-organ failure will be there. The important symptom is fever with chilled rigor. One periphery is due to vasodilatation, bounding pulse, rapid capillary filling, or hypertension will be present. Next is neurogenic shock. The cause is if there is a spinal cord injury, high cervical spinal cord injury, if there is a deep anesthesia, devastating head injury. What are the symptoms will be present? Like paralysis below the level of lesion, hypotension, bradycardia will be there, loss of sympathetic tone, atrial and venous vasodilatation. So there will be one dry skin and hypothermia will be present.